Hello, dear aquarist, dear discus lover. Well, I don't know, you will love this discus I will show to you because it had a mix of infections, several parasitic infections. For me as a fish doctor, wow, interesting to get this kind of material for examination. And I think also interesting for you to understand that there can be a multitude of diseases appearing on a fish. So you're going to have a complex method of treatment. Maybe you have ideas about treatments. You can always put your comments below and I will see if I can reply and maybe other people might be interested to learn from you. But this discus, well, it had a mix of problems and interesting to share this with you so you understand what we can deal with. Because the discus had fin rot and several parasitic infections, worms, Spironucleus, Tetrahymena, and Nyctotherus. What a mix of problems. In my books on fish diseases, you can learn about discus diseases, how they start, how to prevent, how to treat. If you don't have my books yet, try to obtain. They are available in different languages. Here we have the fish tank where the fish were suffering, not swimming normally, not eating normally, not acting as a healthy discus that swims around and looking for food and looking for you, that you try to show up with a fish food. And we took out the one which was badly damaged. You could see the very badly damaged tail and excessive mucus on the fish. So we took a scraping of the skin and you could see the tail rot. You could see the extra mucus of the fish. So the fish was suffering excessive mucus on the skin, which is not normal. The fish must have mucus, but not excessive mucus. And that's sometimes because the fish is unhappy due to different possible reasons, like being called a discus pest. Different reasons can cause this. And at the same time, we found in some parts of the skin some parasites, Tetrahymena. Not many, and that's why there were no serious bloody red wounds to be noticed. Because if many Tetrahymena are there, and that can be possible in the coming days, because they can multiply very quickly and start to making holes and eating the fish alive. That's Tetrahymena. Very few. Here I have a detailed view how this ciliated parasite moves around. It's interesting to observe that those little creatures, animals, can be nasty for our fish. I have several videos on that on Tetrahymena. See on my YouTube channel and look for Tetrahymena. The gills look pale, again, should be nice red, and we found gill flukes. Again, a case with gill flukes of discus because the gill flukes is a common disease in discus fish. It's a very common problem. Here you see how many are here. So if you take a gill scraping, very hard to get these gill flukes on your plate for a microscopic examination. So just scraping the gills might not always be good to have some examples of gill flukes ready for examination in your microscope. So it's, in my case, I'm happy you have the time and opportunity to take out the worst damaged fish and to sacrifice it because it's going to die anyway in the coming 24, 48 hours. And it helps me to do a good examination and saving the other fish in the tank. Here we see a detailed view of gill flukes. See how they're moving around, attached with hooks and causing serious damage to the gill tissue. The organs had a lot of fluids. You do open it and you can see a lot of fluids coming out of the fish, a lot of fluids in the gut, which was whitish. The organs had melanomicrophage centers or MMCs in the spleen here on the left and on the right in the liver, as we know and explained before, usually caused by bacterial infections, and the organ defends himself. Inside the gut or intestine, we found Capillaria nematodes. You see this worm moving around and of course having an impact on the health of the gut. We also found Spironucleus parasites, the tiny parasites here, and we see one bigger one here, a Nyctotherus parasite, a ciliated parasite. More on other parts of the gut or intestine. Here we see two of them. They're not so nasty as Spironucleus or Hexamita, because those little ones cause very serious damage. But still, those parasites shouldn't be there. And if there are too many, they can have a problem for the gut flora, the microbiome, and having an impact on the digestive tract or gut. See, here are quite a few already on this part. So different parts of the gut has different quantities of parasites. At the same time, I show again, we could see the Spironucleus or Hexamita parasites next to the Nyctotherus parasites here in the water. Not so many to see here, depends on the part of the gut you examine, but here are quite a few. Here in detail, you see also the Spironucleus and you see the Nyctotherus. Nice observation of these parasites. So the treatment, of course, treating the Spironucleus or Hexamita and the Nyctothera, because they're damaging the fish, must be treated first of all. Usually metronidazole is a good product to help in the control and the killing of those parasites. The gill flukes and the worms, Capillaria, are next to be treated, and think about repeating to kill the eggs of the Capillaria and the eggs of the gill flukes. Follow the protocol I described in my books or in the leaflet of the medications you obtain in the pet shop. Commonly used are fenbendazole, piperazine, mebendazole. Think about the secondary bacterial infection. If you treated the parasites and the fish is still suffering, not doing well, you might think about using an antibiotic to heal up the fish, the damage. Look at the damage on the tail. So, but first of all, kill those parasites. The bacteria were not that badly having an impact on the gills yet, like we had in other videos. So I would recommend here in this case first Spironucleus. But in some cases, yeah, you treat also bacteria at the same time with the Spironucleus. Some suggestions we make, also in my books. In this case, I would recommend to treat with Dr. Bassleer Biofish Food Lapacho as a food that helps during the treatment, to helps to fight off this infection. My books on fish diseases explain you a lot. Try to get them if you don't have them yet, and I have them in different languages. Or go to my training at my Patreon, where you can learn more about preventing diseases or diagnosing. Many different options are available. So I hope this video let you understand that it can be a complex problem of fish diseases, not just one, but many different ones. Parasites and bacteria, different parasites, different approach is here necessary. And you can see that the microscopic observation is very important to find out eventually what you have to do. Try to learn to use a microscope if you deal with fish in a business or as a breeder, or when you're a serious hobbyist with many fish tanks. Thank you for watching.